Well, we've heard the old thing about the foot bone connected to the leg bone and the knee bone and all that stuff. Well, surprisingly enough, your ear, nose, and throat, they're kind of all connected together too and deal a lot with your health and some serious problems that you possibly could have. Well, today we're at Coastal ENT, part of Sinus Clear, with David Burkhart, who's the Chief of Operations. How are you? It's good to see you again.
Good to see you. How are you doing?
I'm doing very well, very well. And that is true. I mean, Coastal ENT here, I know Dr. Pashota, Dr. Bratton, they see a lot of people with problems in these areas.
Correct. Anything having to do with the neck up, basically, they take care of. So we see, particularly during certain times of the year, obviously there's living in the South, a lot of allergy problems, a lot of sinus problems. What sets us here at Sinus Clear apart from some of the others is we do a lot of procedures in-house now that others don't. True, we have our own in-house mini CT machine. So you come in with a sinus problem, we can put you in the CT. 2 minutes later, the doctors have the image on the pad, and they can actually give you the diagnosis right then and there, let you know what's going on, if it's something that they can hopefully treat medication-wise or possibly need surgery. We also now do a lot of surgeries in the office under what we call conscious sedation for patients who maybe are not good candidates or they don't want to go under general anesthesia.
Right.
We can do a lot in-house now where you're sedated, you can actually hold a conversation during the surgery.
So you know what's going on, but you really don't care.
Right, you don't care. You don't care and you don't remember. That's a good thing
stuff,
too.
Yeah.
But no, so we do that in-house, 45 minutes, the procedure's over, 20 minutes later, you're up and on your way and going about your business. Makes a huge difference for the patients, you know. So.
And again, takes about, what you said, just a couple of minutes to do the scan?
Correct.
And find out what kind of issues that you're having.
Yeah, exactly. And the good thing is it projects the image right to the physician's iPad. So they've got it the minute the images are done and loaded up to the machine.
And there's so many different issues that people have with their sinuses.
Correct.
That can cause some major medical issues and put a threat on their life.
Oh, most definitely, and one of them being sleep apnea is part of that as well. And Dr. Pashota also does sleep medicine, so we do sleep studies. The patients come here for their results, and we address their issues with that as well. We also have an in-house audiologist, so we do hearing testing, supply hearing aids. We do allergy testing also, and we do the treatment once the tests are done. So we kind of do the whole gamut. We're more of like a one-stop shop for your ear, nose, and throat. You know.
Well, tell us some of the other things that we're talking about the nose. We talked about that, but let's talk about the ear. Some issues that people could have there. You mentioned hearing loss.
Correct.
Problems there.
Hearing loss, tinnitus. The ringing in the ears. We address that as well, particularly with children, the tubes, constant ear infections, elderly people. Lots of times their hearing loss is just because of a lot of wax buildup.
Right.
So we take care of that for them as well.
Clean it out and it's like, whoa.
Exactly. They can actually hear. Sometimes you hear the ladies up front yelling or screaming at a patient. You're thinking, oh my goodness, what are they doing? It's because they can't hear. But when they come out, they don't have to, the patient, I've actually heard them say, you don't have to yell at me anymore, I can hear now. So it really does make a difference, just that wax buildup in the ears.
Of course, as husbands, we can call it selective hearing. When we're at home, you don't want to,
No, we won't put
use that a few times. I wear a hearing aid now, so that doesn't go over too well anymore.
No, I'm sure. I'm sure.
Talk about, if you would, David, as far as throat issues.
Throat issues could, lots of times sinus drainage will cause sore throats or tonsillitis, adenoids, those kind of things, ulcers. People, sometimes you'll get ulcers from acid reflux and stuff like that, just general things like that. But we do take care of all that. Cancers, the doctors, we also...
Throat cancer,
yes, we'll treat that, all that kind of stuff. So anything having to do with the neck up. One of the big deals we do now with this in-office surgery is the balloon sinuplasty. So it's actually a balloon dilation device that goes up into the sinus cavities, and instead of breaking and cracking and cutting, it actually inflates and expands and dilates. Kind of like they do with your heart
whenever, as far as, your...
very similar. Dilate the vessels.
Exactly.
Yes.
Exactly. Open
Very
them
similar.
up some.
Exactly. And it's a lasting procedure, so it's not just a short temporary fix. It is a lasting procedure. But it's a lot less invasive and it's a lot quicker and
without having
better
to do
on the patient.
Full surgery or any kind of thing like that.
Right, right.
And I imagine that's one of those things that they can come in here and, again, do kind of the light anesthesia, so to speak. And
Right. We actually do those without anesthesia for patients that don't want any anesthesia. It's a procedure that can be tolerated very well.
It probably doesn't take very long to do.
No, half hour. Yeah.
And you probably see a lot of this year long here because as far as the way the weather is on the coast, people have allergy problems all year long.
All year long here, and particularly this time of year, they tell you if you don't like the weather, wait a minute, it changes so
Exactly.
quickly. So people are constantly getting sick with the sinus problems and the pollen and whatnot. Yeah, so we see a lot of that, a lot of allergy issues.
Now, the ear, nose, and throat. If you're having any issues, I know one of them that could be a sign of something serious is snoring.
Correct.
Really heavy snoring.
Snoring, and that's also could be related to sleep apnea and whatnot, and
Right.
Dr. Pashota particularly, but both do address that. We have a sleep lab called Integrated Sleep Solutions that Dr. Pashota works with, and then, like I said, then we treat them here as well. So they deal with all that.
Now, does someone need to get a referral from their general practitioner to
make an appointment?
Yes.
Not generally. Some insurances require
Right.
referrals, but for the most part, no, you can self-refer to come here.
Okay. Okay.
And we see pretty much every insurance.
Okay, that's good. So and of course, where you're located at is here on CT Switzer Road in Biloxi. You're just right across the tracks from the TV station.
Exactly.
The big tall building. You're in Suite 400.
Right,
Up here.
right here. We also have a location on Cedar Lake.
Okay.
We have a location up in Orange Grove next to Garden Park Hospital.
Yes.
And we've recently opened a satellite clinic that we go twice a month up in Wiggins.
Good.
So
So you really cover the entire Gulf Coast area.
Yep.
Make it convenient for everyone.
we try to, yes.
That's wonderful. That's great. So again, if you're having any kind of problem, I want to thank you for your time. It's
Thank
good to
you
see
very
you again.
much.
It's been a while.
You too. Yes,
and
it is.
Again, if you're having some issues, ear, nose, and throat issues, whether you might be having sleep apnea, having some problems breathing at night, you can go on their website and find out some more information as well. See if you're a candidate for any of the surgery, or again, just come in here and get a checkup and find out if there's some issues that you can get some relief from, whether it's your ear, hearing, wax buildup, or whatever, or your nose, as you said, you can't breathe anymore.
Yeah.
Happens a lot down here on the coast. I mean,
It does.
especially as you said, just wait 5 minutes, the weather's going to change.
Exactly.
So that really wreaks havoc on us, or any kind of problems with throat drainage or anything like that. But it's Sinus Clear, part of Coastal ENT. Again, they're located in several different locations along the Mississippi Gulf Coast. Check them out.